A skin tag is a small overgrowth of skin. These polyps have a core of dermis with loose collagen fibers, few blood vessels, and very few nerves. They contain fat cells and are covered with epidermis. They have no hair, no oil glands, and no sweat glands. Skin tags are commonly found on the eyelids, underarms, genital area, under the breasts, and on the upper chest and neck. They are thought to form where the skin rubs against skin or against clothing. Studies found that people with large number of skin tags are insulin resistant, often overweight, have high cholesterol, and high blood pressure. Skin tags suggest an increased risk of cardiovascular disease. However, the National Institute of Health says that 46% of all people have skin tags and 60% have them by the time they're 70 years old. Genetics play a major role.
Skin tags can be nearly clear or pigmented to dark brown. They come in a variety of shapes and forms. Don't worry about the various terms given to these different shapes. The only thing that matters is how they're connected to the underlying skin, because how they're connected determines the correct treatment. Skin tags that have a neck, called a peduncle, are called pedunculated skin tags. I call them mushrooms because that's what they look like, and I can't pronounce pedunculated very easily. Other skin tags have no neck. They're flat and attached around the base. These are sometimes called bag form skin tags. Whichever the form, whether they're attached or have a stalk, they can all be removed very easily. Most skin tags are removed without examination. Skin tags that are larger, bleed, or look questionable may require pathology examination to make sure that there are no irregular cells or skin cancers. Okay, so what Josie's doing here is she's demonstrating a home little technique you can do to remove them. She's tying a little slip knot, and this process is called ligation, and that's basically called a ligature, that thing that she's putting together, and it's like a little slip knot. It's like a little noose. She's going to put that right around the thing and choke it off from its blood supply. There you go. She's slipping it right over the thing, and you can only do this on ones that have necks. And then she's cinching the thing up right there. There you go. And she's tightening it. You can actually remove these things by freezing them off and just cutting them off. But this is a nice little technique you can do at home. The thread she's using is actually surgical thread, and she's tying the knot now, but you can even use dental floss. Make sure it's not waxed so that it stays knotted. And she'll knot that thing and get it real tight, and she's shutting off the blood supply and then trimming it up. There you go, Josie. And then in a couple days the thing just drops off, and you can see there's really no scar at all. It's really a great technique. Josefa is demonstrating how electrologists remove skin tags that have a neck. These are the pedunculated skin tags that look like mushrooms. Josefa is pulling the skin up so she can get to the base of the skin tag. If you're a client and worried about this, please know that electrologists have been removing skin tags like this since 1925. This is a safe treatment that cannot cause scars. Josefa is using her thermolysis at the highest setting and desiccating and cutting through the tissue. If you look closely, you will see that she's cutting through at the very base of the tag. Notice too that there are tough collagen fibers that need to be cut off as low as possible. So here are the before and after photos of the skin tag and a dish with the tags she's removed. Look at the after photo. This is exactly what you want to see. It should look like a little volcano. She removed the collagen strands at the dermal level. Notice the epidermis forms a little ring. This is not going to remain. the ridge of epidermis will desiccate and dry out, and the epidermis will reform completely and perfectly at the original skin level. You'll never know the skin tag was ever there. Physicians usually just cut off the skin tag, and that's fine too. Of course, with thermolysis, there is no bleeding, so that's a nice feature. Josefa shows how electrologists remove attached base skin tags that have no neck. With these skin tags, the string technique won't work, and cutting them off causes unnecessary bleeding. Freezing them off is fine, but your electrologist has the best and safest technique for removing skin tags. Josefa is desiccating or drying out the attached skin tags with her currents. The tags fall off, and the skin heals under the dried out skin tag. When done correctly, there are no scars or lasting marks whatsoever. Your therapist has 2 currents she can use. These currents can be used separately or in different combinations. Most therapists rely on thermolysis to remove skin tags. The currents used by electrologists are much lower than the currents physicians use, and they are perfect for skin tag removal. Indeed, there is significantly less chance of scarring from having an electrologist perform this than a physician. Medical authorities in Europe and the UK recognize this, and they recommend electrolysis for the removal of skin tags. If you are an electrologist wanting to remove skin tags or telangiectasia, first check with your governing authorities. Also, do not purchase another machine to do these treatments. You already have an electrolysis machine, and this is the proper machine for these treatments. All of the machines that are being sold to electrologists and estheticians for the skin treatments are in fact nothing more than standard electrolysis machines with a different trade name and horribly overpriced. The British Association offers classes in skin tag removal. Please contact them for more information. And thanks for watching.